Bismillahirrahmanirrahim. So if you have been following from my previous videos in this playlist, you know about the study of nematodes. In nematodes, we have classified it into the intestinal nematodes and the tissue nematodes. In this, I had the intestinal nematodes, we had the ETA mnemonic, which are spread through eggs, and then we had the other mnemonic AST, which are spread through larvae. From the AST mnemonic, we had the ankylostoma and negator. Then the second one is strongyloides. Now we are going to study about strongyloides. And the next one is the trichinella that we will be studying in another video. So now we are going to discuss about strongyloides. Majorly, we can discuss about it is the infective form. Now you know how it is going to spread through the larvae that is going to enter into your body, and majorly the larvae is going to enter into your body from your feet. So uncovered feet are the most common cause. Now there is this filariform larvae that is the infectious form. When you take this filariform larvae, what happens is that the larvae goes into your body, enters the circulatory system. Now it enters from here into your foot, then it enters the circulatory system, it goes up and it goes into the alveoli of the lungs, then the bronchi, then it goes into the trachea, and then it goes into the pharynx. From here it goes from the pharynx, it is swallowed and it goes into your small intestine. Because it is intestinal nematode, so it is going to be going to the small intestine. So when it goes to the small intestine, it becomes adult where in the small intestinal mucosa. Now within the small intestinal mucosa, adult female worm is present. That adult female worm, that larvae becomes the adult female worm, and that adult female worm, then it gives rise to these eggs. These eggs, they can be deposited within the intestinal mucosa. They hatch over there and they migrate to the intestinal lumen. So firstly, the larvae was taken up from your foot, then it went into the circulatory system, from where it got into your lungs, then it got swallowed via the pharynx, then it got into the intestinal mucosa. Within the mucosa, it grew, it formed the adult female, then the female laid eggs, but the eggs from the mucosa, they went now into the lumen. Now these luminal eggs, they give rise to this rhabdiform larvae, that is the feeding form of this larvae. Now this larvae can be excreted in the stool or it can go into autoinfection. The one that is excreted in the stool, it goes to form its life cycle in the free living form, whereas the one that is going to do the autoinfection, that is going to be in the body again. Now which people or which classes are susceptible to the autoinfection? The people that have their competence compromised, they are on immunosuppressants, or the people who have their immune capability decreased, like the AIDS, the people that are affected with AIDS, the people that are affected with the human T lymphocyte virus. Then if you are on tumor necrosis factor inhibitor drugs, or you are taking corticosteroids, in such people, they are susceptible to immunocompromisation and they are susceptible to this autoinfection. But when this autoinfection takes place, the viral load in the body increases. This rhabdiform becomes the filarial form again. It damages the intestinal mucosa again, and you get what you call a hyperfixation syndrome, or that is hyperinfection syndrome, or massive reinfection is produced into your body. Also, it can go into the perianal skin and it reinfects majorly through the perianal skin. Now this was about reinfection, and reinfection is occurring in people with AIDS or the people that have this T cell lymphotrophic virus. The two viruses are here. Then the people who are on drugs that are going to decrease the immunity, that is TNF inhibitors and corticosteroids. Or it can occur in the patient who is severely malnourished, because his immune system will also be compromised in that situation. So that was about the life cycle in the body. Then next thing is the life cycle outside the body. Now this rhabdiform larvae, it gets deposited into the soil. From the soil, in the warm and moist soil, the rhaptidiform gets converted into the adult female form, the male and female form. They mate, they produce eggs. The eggs, they hatch, and the rhaptidiform larva then becomes the filarial form, and now it forms the new generation of the adults, and they can grow. This whole cycle grows within the soil. But sometimes, because a person who is having naked feet, he walks over there, so he can get the filary form again, and the whole cycle repeats itself. This is how it takes place. Or the rhaptidiform larvae, it can be released into the soil, and instead of growing into this the female and male form, it can just grow into the filarial form, and then it can infect the body. So 3 life cycles are there. One that occurs inside the body, the auto-infection one. The second one, the rhaptidiform converted into the filary form directly, or the rhaptidiform converted into the male and female form. They mate, they produce the egg, and then they produce the filary form. So this is the 3 type of strains the whole strongyloid bacteria, the strongyloid nematode has. And this strongyloid life cycle is known as strongyloidiasis. And the full name of this is Strongyloides stercoralis. Now after that, where they can be formed, they can be found in places where the person has, where the soil is very warm and moist, that is in the tropical regions. Another thing about that is, since they're entering from the feet, so they can cause pruritic or itch in the foot. After that, another thing is that because they are infecting the intestinal mucosa, they can produce watery diarrhea. Because they are present in the lungs, they can also produce eosinophilic portions in the lungs. And because these infections, the auto-infection, it is severe, what it can do, apart from producing watery diarrhea, it can produce abdominal pain, it can produce rashes, and eosinophilia is always there. Now we can talk about the diagnosis. How can we diagnose it? Majorly, larvae, they can be detected in the stool. Instead of eggs, there are larvae in the stool, so we can detect it over there. Second thing that we can do is eosinophilia, that can be detected in your body. So larvae, eosinophilia. And third thing is to find antibodies related to larval antigens that your body is producing. So 3 things are there: the larvae that can be found in the stool, the antibodies that are produced against the larval antigens, and third thing is eosinophilia that is generalized in the body. Treatment is given by ivermectin, but sometimes albendazole can be used, but ivermectin is drug of choice. And how are we going to prevent it? See, there are 2 things how they're entering in the body: via naked foot on the warm moist soil. So you're going to wear your shoes, you're going to prevent it. Second thing is disposing of sewage properly, because it is the sewage is in the warm and moist soil, and that is producing this larvae. So disposing of this thing properly and wearing shoes is the most prominent treatment of this one, or prevention of this one. And if, for example, you take a person who is having a disease that is known as in which you have to give them immunosuppressants like the tumor necrosis factor alpha or inhibitor and the corticosteroids. So you find out that that person that you are going to give this immunosuppressant has strongyloidiasis in his body. So what are you going to do? First, you are going to treat them with ivermectin before giving them the immunosuppressant drug. So this is how it can be treated in such people. So that was all about strongyloid and the strongyloidiasis. In the next video, we will be talking about trichinella. That is also a type of nematode spread via the larval entrance into your body.